Good morning, everyone, and thank you for joining us today. My name is Sean Horrigan. I'm a Marketing Communications Associate with Commonwealth Purchasing Group. For those of you that are unfamiliar with our program, we are the leading group purchasing organization for community health centers and other nonprofit organizations. I encourage you to visit our website at cwpurchasing.com to learn more about how we can help your organization save money. Today, we are excited to have Eric Black and Mike Neal here to discuss best practices for cost containment and workflow efficiencies. Let me tell you a little bit about Henry Schein before I introduce our presenters. Henry Schein is a solutions company for healthcare professionals powered by a network of people and technology with more than 22,000 Team Schein members worldwide. The company's network of trusted advisors provides more than 1 million customers globally with more than 300 valued solutions that help improve operational success and clinical outcomes. Their clinical technology and supply chain solutions help office-based dental and medical practitioners work more efficiently so they can provide quality care more effectively. These solutions also support dental laboratories, government and institutional healthcare clinics, as well as alternative care sites. Now let me give you a little background on our presenters. First, Eric Black. Eric Black is an equipment specialist extraordinaire for Henry Schein Dental with an impressive 29-year journey in the dental industry. For the past 19 years, Eric has dedicated his expertise and steadfast commitment to serving the dental community through his role at Henry Schein. Eric's passion lies in the community health space, where he actively seeks opportunities for alignment with the mission and vision to expand access to care. Eric assists the advancement of oral health care with the implementation of equipment and technology solutions to improve patient outcomes, enhance diagnostics, and streamline treatment. With a deep-rooted desire to serve the most vulnerable, Eric's dedication extends beyond his professional endeavors, making a profound impact on individuals and communities. We also have Mike Neal joining us today, and Mike is a dedicated and passionate field sales consultant for Henry Schein Dental, operating in the vibrant region of Southern California. With an unwavering commitment to making a difference, Mike has found his true calling for helping our esteemed community health center clients expand their reach and flourish. Recognizing the significance of his role, Mike derives immense fulfillment from empowering health centers to optimize their operations by facilitating their own growth. He takes pride in knowing that he is making a positive impact on an underserved community and championing the cause of the most vulnerable. Mike firmly believes in advancing health equity and is determined to play a pivotal role ensuring that everyone, regardless of their background, has access to quality health care. Today's webinar is designed to last for 30 minutes for the presentation portion and 10 minutes for the Q&A period. If you have a question, please type it into the chat and I will make sure that Eric and Mike have the question at the end and can answer it for you at conclusion. At this time, I'd like to hand it over to Eric and Mike. Actually, we're going to start with some poll questions. Is that right? We're going to start with one, I believe. The first one, are you a CPG member? And that is a yes or no answer. Second question, are your staff members trained to perform preventative maintenance, or is this something you outsource? Your options are yes, they are trained on preventative maintenance, or no, we hire an outside company to perform preventative maintenance services. Question number 3, how do you decide which products are utilized in your healthcare? Your options are products are used based off doctor preferences. A dental committee decides which products of our health center uses, or option 3, special pricing and or current promotions influence choice of products. And finally, What criteria do you utilize for selecting dental equipment? Pricing, pricing options, longevity of equipment, post-sale support, all of the above. So please mark your answers because this will help our presenters direct the conversation today and get a better sense of who we have online. Okay, so we have the results. About 33% of you are CPG members and 67% are not. Question number 2, 67% said no, we hire an outside company to perform preventative maintenance services, and 33% said yes, they are trained to perform preventative maintenance services. Question number 3, an overwhelming number of people how do you decide which products are utilized in your health center? The 100% response was products are based off a doctor's preferences. And number 4 is also 100% response. What criteria do you utilize for when selecting dental equipment? And the answer for 100% was all of the above: longevity of equipment, post-sale support, and pricing. So thank you so much for participating in that poll. And right now I'd like to hand it over to our presenters. Thank you so much for joining us today.
Thank you, Sean. Hello, everyone. Amanda Len, Director of Community Health for Henry Schein here. I'll be moderating our panel today. Let's get started. Our first question is for you, Mike.
All right.
What are the top 3 strategies you recommend for streamlining the procurement process for community health centers while still maintaining high quality oral health care, Mike?
That's a great question. And traditionally what we want to do first is we want to establish a budget for supplies. This is something that's important, and it gives the team parameters for what they're going to be ordering on a monthly basis. A couple things that we want to take into consideration with a budget that we implement is we want to make sure that we're reasonable with it, because we want to ultimately allow room for growth as we acquire or add new patients to the location. We don't want the staff cutting corners, but we want to make sure we do adhere to the budget. And another thing that we want to look at is, I know a lot of community health clinics have multiple sites. So we want to make sure that each site has its own budget based on their own production. We don't want a universal that some sites might have more production, need more supplies. So we want to be careful of that. The second thing would be to create a preferred shopping list. And within Henry Schein, what we call this is an e-catalog. And this is basically a formulary that's unique to your organization. It helps provide cost containment measures and ensures that we have product continuity for all locations. A couple best practices with this are that anything that goes into the garbage or that is disposable is usually what we want to have as a private label or the Henry Schein brand as we have it. And for any technique sensitive products, we like to choose a primary manufacturer that we can partner with and leverage our buying power to ensure that the cost of goods stays lower. Number 3 would be to implement measures of inventory management. Essentially what you want to do is choose a supplier that can get you the products that you need when you need them. And this is really important for us because it allows us to avoid buying excess amounts of inventory. When we do stuff like that, or if we're buying in bulk because we're worried about shipping times or something like that, it can affect our cash flow. It ties up inventory. We can run into expiration problems. And essentially what we want to do is make sure that we get you the products efficiently. So at Henry Schein, traditionally we get you the products within 1 to 2 business days. So this allows us to make sure that we only have to purchase what we're going to need for that month. And that's those are 3 great examples of what we can do.
Thank you for sharing those very important best practices for procurement process success, Mike. Can you provide an example of a cost containment project that you've been a part of with a health center?
Yeah, we Listening to the poll questions, there was something that was pointed out about product preference for the providers, and that was something that we ran into on one particular project that we were working on. And essentially, what we were doing is using our purchase analytics to assist with creating buying power and building an e-catalog for an organization. And we ran into a couple of hiccups as we started our inventory process, because we went around and wanted to see what the organization was using. And when we did our inventory, what we found is that in the drawer, there were 4 to 5 different brands of the same type product. An example was the composites. And this was primarily due to the providers that they had, because this particular organization had multiple sites. So they had multiple providers at these sites. And with the preference that the providers had is what they were using. So what we discovered is when we had 4 to 5 different brands of the same product, we weren't taking advantage of our buying power. And what this issue is it doesn't align with our best practice model that we have. And what we had to do is really narrow it down to a manufacturer that could give us all the products that we needed. It was the quality that we needed, and it allows us to eliminate some of the other ones. And it gave us the ability to help with our buying power, because when we were streamlining our purchases, it allowed us to lower the cost with that particular manufacturer. And that particular brand met all the needs that we had. And we were allowed to utilize this, create an e-catalog that helped for the organization and really streamline their purchasing.
Thank you, Mike. That's a great example. Creating and taking advantage of buying power is important for cost containment. Let's pivot now to Eric. Eric, you've helped dozens of health centers expand their dental footprint. Will you share more about balancing short-term cost reduction goals with long-term financial sustainability and growth objectives?
Good morning, everybody. Yes, balancing short-term cost reduction goals with long-term financial sustainability and growth can be challenging. It requires careful planning, strategic decision-making to achieve success. A few best practices to consider are: 1, focus on efficiency. Identify areas where you can improve efficiency without sacrificing quality. Creating an expansion plan that is scalable is a great starting point. We essentially create a model we can copy and paste, so all future products will emulate our best practice model. By doing so, you create a level of consistency, familiarity, and comfortability with the equipment. 2, be diligent in preparing and planning the design of an expansion. You should always take into account the future capacity that will be required to meet the needs of your community and the ability to integrate additional services. We've had situations where a new location reached maximum capacity within 1 year because they didn't properly estimate the size of the community and growth. 3, invest in innovation can lead to long-term growth and competitive edge. There isn't always room for full adoption of technology with every expansion, but it's important to prepare your expansion with the future implements in mind so that you can avoid future construction costs and downtime and easily bring the technology into the office later on. Many of these technologies could lead to the staff efficiency, which could help with increased production.
Thank you, Eric. What else should a strategic expansion plan for a health center include?
A strategic expansion plan is the comprehensive roadmap to success. I could spend the entire 30 minutes of this webinar detailing the process of the expansion, but for time's sake, the clinic should be patient-friendly design, but also efficient and safe for all staff members. This includes a focus on prioritizing infection control while meeting regulatory compliance standards such as ADA and Joint Commission. One example is having enough autoclaves and instruments to handle the patient flow. The expansion should also include selecting equipment and technology solutions that will meet the needs of the clinic, withstand a high patient volume in healthcare settings, Equipment with a robust reputation for quality and durability is better than low-cost brands that'll end up costing more over time due to lost production during repairs.
Thanks, Eric. Can you share a little bit about the assistance with meeting compliance requirements by the ADA and Joint Commission and others, and how you've helped health centers with that?
Basically, what we've been able to do is make sure that they have all the users' manuals on hand, make sure they have all the instructions, how to take care of the equipment. We do the preventative maintenance, go in there and do preventive maintenance on the autoclaves, make sure the x-rays are calibrated once a year, do the preventive maintenance on air compressors and vacuums.
Thank you. Those are very important. So the last question I'll open up to both you and Mike. What other measures should a health center take following an expansion to ensure the ongoing upkeep and ongoing upkeep of their equipment and the continuous cost improvements across their organization? And Mike, you want to go first, or Eric, would you like to go first?
I can
Go ahead,
I can jump on this. This is something that's really important, especially after we do an installation of equipment, or if it's a new location build out. And essentially what we want to do is make sure that we partner closely with our manufacturer reps. We want to make sure that they're available to go in and do an in-service with the staff, make sure the team is all trained on the equipment, they know how to use it. And essentially when we have success with training and the staff feels comfortable, we're going to have more success with that equipment. They're going to feel comfortable using it. They're going to feel more comfortable maintaining it. And it's kind of an important part of that follow-up after an equipment installation. And another really important thing is what Eric touched on, the preventative maintenance. When we do this on a regular basis, if we set up a preventative maintenance program, we can ensure that we have our technicians going out there and making sure the equipment's performing as it is. We know that in the community health clinic, there are high use and high production type environments. So the equipment really does get used a lot more than say in a traditional practice. So the more we maintain and the better job we do of preventing future issues, the longevity is really going to be there for the equipment. So it's really important with that aspect.
Thanks, Mike. Anything additional you want to add to that, Eric?
No, Mike pretty much went over it. Just make sure that the doctors, the staff, everybody knows the equipment, how to use it properly. One of the things that we try to do is make sure that the equipment going in, anybody could use it, a left-handed provider, a right-handed provider, staffs, and that make it functional for any provider coming in to get ready to practice.
That's important. Anything else that they should continue to do, Mike, from a cost containment standpoint of the supply side of their business?
Well, we want to make sure that we're always aware of new products that are coming out. We want to make sure that we're looking for efficiencies with the products. As what I've noticed over time is the products really haven't changed that much in what they actually do. What's changed has been the implementation or how it's used, the speed in which products can be used. So as you know, and many times when we partner with our manufacturers, we can bring them in to do training, or we can bring them in to do, say, a lunch and learn type environment where they can inform the staff and the providers of what the products are, what changes have been made, what's new. And what we found is, especially in the community health environment, is that the manufacturers are really friendly with this type of education. Essentially, they know that the more education they can provide to the teams that are using the products, the more success they're going to have. So just be aware of what's coming, what's new, and we can help with that.
Great. Thank you, Mike. Any other best practices or tips regarding expansion, supplies, anything else that our health centers should take to heart? Mike, Eric, that you'd like to share?
One thing I would say, Mike touched on it earlier, putting together like a formulary, a list of what your group uses, what your group buys, Many times when Mike and I go into a new community health center for the first time, meeting them, going through the office, we'll, seeing sterilization or in drawers, there are dozens of unopened hand pieces, different brands, this and that. As long as we could keep everything uniformed where it's pretty much the same, you don't have extra inventory just sitting in there, and that's wasted money.
And that's, I'll piggyback on that a little bit too, because that's a great point that Eric's making, that, especially if you have growth or if you have more than one location, essentially what we like to do is we kind of create a template, or what we kind of call a stamp and go, as we build out or do something new for the organizations. We want to make sure that our model is the same. So from site to site, you have product continuity, whether it be the hand pieces, the X-ray units, the things that we're using, the chairs, the lights. We want to make sure that we have product continuity. So if a provider does, and we have in many of our organizations we work with out here, we have providers that go from different site to site. So when they walk into one of their locations, they trust that the equipment, that the hand pieces, the curing lights, the stuff that they're using is going to be the same that where they were before. So I think product continuity and being familiar with your environment is really, really important.
Thank you, Mike. Can you provide any insight around helping customers select technology? Helping health centers select technology for their practice?
Yeah, technology is kind of, it's obviously changing on a rapid basis. And essentially what we're looking at these days in community health is some of the technologies coming down. Obviously, panoramic X-rays are important and they're used widely. Making sure that we link those up. Digital X-ray sensors are widely used as the preferred use of X-rays. What we've found locally here is, and in some other markets as well, is that the use of digital impression scanning is becoming more and more prevalent. And this technology is widely used in the private practice. It's nothing new, but in community health, it's really starting to catch fire, because not only is it a great tool and technology to use for the impression, it's more comfortable for the patient to be able to use a scan than it is to obviously do traditional impression material. But one of the big features that we've found, and that the organizations we work with are really, really appreciating, is the time savings for the staff. We know that if you have a busy environment and you have a waiting room full of patients, if the staff can be more efficient with their time by using, say, a digital scanner for impressions, and they can do that procedure more effectively and faster, that's going to allow us to bring more patients into the operating rooms, operatories, to be seen. So we can use that technology not only to be efficient, but it's obviously better care for the patients as well.
Great. And it's also a wonderful cost containment measure, right?
Yes.
Correct.
Yes. Impression material is something that if you're using it, it's going to be an annual cost year after year after year. You can invest in a digital scanner, and that's a one-time investment, and it's going to last for many years. So from a cost containment over time, it's definitely going to be a benefit.
Great, thank you, Mike. How have you seen any health centers that you can share best practices on implementation of telehealth or teledentistry, and how that has also helped to increase access to care and assist in cost containment?
Yeah, that teledentistry is really kind of caught fire over the last probably 3, 4, 5 years, maybe even going further back. Teledentistry, and also mobile, using the like a coach or a mobile dentistry to get out into the community, because we know that in our market out here, and I know in many markets, we can't have a clinic in every single underserved population. But telehealth and also mobile dentistry has allowed the clinics to get out into the communities to bring the care out into the community. So these are great features that extend the reach of the organization and allow them to get out there and provide that care that everybody needs. So this has been really important, and it's growing rapidly.
Thank you, Mike. You just mentioned taking care into the community, which spurred another question for me. I hope you don't mind. In Southern California, school-based health center programs are prominent. So can you share a little bit about how you've helped to develop cost containment measures for school-based health centers? And Eric, maybe you can weigh in on the portable equipment piece?
Correct. A lot of our organizations are teaming up with the local schools and going in there. And so we have to find out what they're wanting to do, what they're wanting to achieve, and look at the portable equipment and make sure that it's easy for a staff member to take it from their car or truck in to set it up. Make sure we know what kind of procedures that they want to do, and that equipment is, one, easy to bring in, easy to set up, and easy to use. So that way they're able to achieve everything that they want to.
You know, and that's Amanda, that's a great kind of a great and interesting, part of the business that we've seen grow around here too, because not only, like Eric said, have we been able to help some of the organizations set up a mobile type clinic to where they can bring the equipment in. We've actually had a couple school sites where we've built a permanent dental clinic right on site. And we've had one of the community health clinics that obviously manages and runs it in conjunction with the school or the school board. And essentially, this has really been helpful because not only does this allow the organization to bring care to the students, what they've also done is opened it up to the students' families. They've opened it up to the community that surrounds that school. So it's allowed the care to come into that school community and then really reach out a little bit to the neighborhood around there and provide care for them as well. So that's been a huge benefit that we've seen grown pretty rapidly around here.
And they're finding that the parents come along with the kids also. And when it first started out, they were just seeing a lot of the kids, but it's evolved into where even at the schools, they're doing work on the parents and other family members also.
That's really impressive. Mike, Eric, when you're building these school-based health centers and they're treating children as well as parents, Mike, do you generally find that you end up doing a separate e-catalog for cost containment for the school-based programs, or do you opt in to use the parent organization, the brick and mortar health centers e-catalogs?
We traditionally use the parent organization. So if we have a community health clinic that actually is the one that's going to be running that school-based system, we'll use the same e-catalog formulary, because even though we're going to use a different, we're probably not going to be doing all the procedures if it's a mobile type environment. Yeah. We still want to make sure that we have that product continuity in the e-catalog formulary, because it's important that the dental director or the management team understands and knows and trusts the products that they're using, because we've approved them to be in their e-catalog. And this is important because it gives them the security to know that these products are also going into those school-based patient community that we see.
Yeah, absolutely. And it continues to grow that buying power, right? When you're funneling the same products. Yeah. Well, we're coming up on time. Is there anything else you'd like to share, Mike or Eric, that we didn't cover today?
Well, I think, just keep what I would say and what we found here, and, we touched on it earlier when Eric was talking about some of the new build outs and reaching capacity. You always want to make sure that you understand the market that you're going into. So if we're trying to get out into a community that's underserved, we want to take a real good look at that community and look and see what it's going to possibly be in the future, because we want to make sure that we can handle the growth. And ultimately, that's what we want to do. The more communities that we can get out to bring care, the more success we'll have. So we just want to pay special attention to that and make sure that we're meeting the community's demands as well.
All right. I have one more question. I got a question from the audience by text message. Can you provide, actually, I have two more questions, actually. Can you provide, Mike, an example of a health center that's taken advantage of maybe the Henry Schein Cares global product donation program and how that's benefited them? So that's the first question. The second question is around single-use products in mobile and school settings. Can you share a little bit around that?
Yes, I'll tackle that question first, because With the Joint Commissions and some of the standards that we've had to adhere to over the last, mostly probably the last couple of years, in terms of using products, single-use products have become more and more popular because the sterilization and the infection control has become really, really important. So, we've seen ourselves go to more single-use type products like burrs that, initially they were probably a little bit more expensive than, say, buying a bag of burrs or something like that. But when you consider the sterilization and when you consider the parameters that go into that, the staff timing, they really are no more costly than using something that you have to sterilize. So we've seen more and more of that with infection control growing using single use.
Okay.
And yeah, no, what was the other question again? It was about.
It was around the Henry Schein Cares program,
Oh,
Give Kids a
yes.
Smile, Global Product Donation Program. How have your health centers been able to benefit from that and cost containment measures?
Yes, love that. So Henry Schein Cares Foundation has been fantastic in community health, and we, I invite. Obviously, I don't run that organization or have really any weight with that, but I invite all of our customers to apply for grants through Henry Schein Cares. The Healthy Smiles, Healthy Lifestyles is a great thing. If an organization is going to go out in the community and do a free day where they're seeing patients and they're doing things to get into the community, Henry Schein Cares, we want to support that. So we'll invite them to partner closely with Henry Schein Cares, apply for some of the benefits that you can get, and make sure that they have their calendar, well documented of what they're doing in the future, so they can continue to do that. So we want to make sure that we invite everybody to visit the Henry Schein Cares Foundation site and apply for stuff like that.
Thanks, Mike. Anything additional that you wanted to share, Eric? I think we started to talk at the same time just a moment ago.
One of the things I would share is, make sure you're partnering up with your local Henry Schein rep. A lot of companies and people don't understand how the community health systems work in that. And what I mean by that is, well, a lot of times in an office, we'll have 8 chairs and there'll be 4 providers. So if one chair goes down, that's like half an office going down for one provider because they have the 2 chairs. And a lot of times getting a technician out for repair, they think, oh, you got 7 other chairs. We could get there in a week. But it is an emergency and you need to get a repairman out there right away because your provider only has 1 chair. So make sure that your representatives understand each one of your facilities and how they work so they can better help you.
That's a great tip, Eric. So I think we're at time. I don't want to go over, so I want to thank you all for your time today. Following this webinar, CPG will be sharing with you a webinar with complimentary CE units from one of our supplier partners, Hugh Freedy. So be on the lookout from that. Thanks, everyone.
Thanks all.
Thank you.
Great. Well, thank you so much. We do have a poll question to wrap things up. Timing on these webinars are never long enough to cover everything. Is there anything we didn't get to today that you'd like more information on? And that's either yes or no question. And if audience members have questions, you can type them into the Q&A box, and I will read them directly to Mike and Eric. Okay, thank you for participating in the poll. Most folks said 67% said no, this was great. Thank you. Mike and Eric, we do have one question so far. How would a member get started working with Henry Schein, and what's the onboarding process like?
That's a great question. And, we, as Henry Schein, we have representatives in most every market in the United States. And so the best way would be to, either look up, or if you don't know your local Henry Schein representative, you can easily look that up, or a lot of the manufacturer reps that we work with know who we are as well. So, the website at Henry Schein could lead you to that as well. we're readily available, and like I said, in most markets. So hopefully we're not hard to find. And my hope is that you've been in touch with someone from Henry Schein, and they could probably lead you to the right person.
And you're welcome to reach out to me directly, Amanda Lynn. My email was on the first or second slide. You're welcome to contact me directly, and I can get you in touch with the right personnel.
Great. Thank you very much. And of course, here at CPG, we're always happy to help as well, facilitate those discussions and connect you with the right parties. We'll just give it a second to see if there's any other questions that pop up. Doesn't look like it. Well, Amanda, Eric, and Neal, and Mike, I really appreciated this conversation. I love this Q&A style format. We haven't done that in the past, so this is something new for us, and I think it works really well. So thank you so much for participating today.
Thank you for having us.
Thank you.
Yeah.
Thank you for having us.
Thank you.
All right, everyone, thank you so much for joining us, and we will be sending you this presentation shortly, and wishing everybody a great day. Thank you so much.
Thank you.
Thank you. Have a good day.